Hello, my name is Tadhg. I'm going to talk you through my study on advanced care planning and palliative care staff that I did as part of my higher diploma in psychology and UCD. I'm sure most of you are somewhat aware of advanced care planning, so I'll just give a very brief overview. So it's all about planning future care and would usually involve reflections, discussions, and then sometimes more formal actions like creating advanced healthcare directives and assigning enduring power of attorney. There are a lot of benefits to ACP, but uptake and awareness are quite low. So only about 2% of community dwelling older adults reported discussing ACP with their healthcare professionals. So really low levels of engagement. And in terms of legislation in Ireland, it's also quite recent. So the Assisted Decision Making Act from 2015 was only fully enacted in 2023. And the ACP policy in Northern Ireland was only introduced in 2022, so it's all quite recent in Ireland. So for this study, we did an online survey of palliative care staff, and we had 105 responses. So there were kind of three parts to it. Firstly, because ACP is a collaborative process usually, and involves normally the individual in question, their loved ones, and their healthcare provider, we wanted to kind of measure and compare engagement as palliative care staff engage in ACP in each of these kind of roles. So their own personal engagement, supporting their loved ones, and then guiding their patients. We then kind of explored relationships between ACP across these three contexts and various psychological variables. And then finally, we had an open-ended question kind of asking to compare ACP for self versus others, and that helped us kind of contextualize the quantitative data. So in terms of our findings, the main thing was that engagement was highest for patients and it was lowest for self. And you can see in the bar chart there that it's out of a maximum of 5. So for patients at 4.6, it was really high. And responses to our open-ended question kind of echoed what we see in that graph, where participants were saying that because of age and their health status, they weren't really considering ACP for themselves very much. They did show really positive perceptions of it, and did consider it a really important part of their professional roles. And you can see that about 80% of staff reported discussing future care with their patients, so really high. In terms of our psychological variables then, we just found that fear of death was negatively correlated with ACP for loved ones and for patients, and then palliative care self-efficacy was positively correlated with ACP for patients, and all the other relationships we looked at there were non-significant. So then in terms of just some conclusions that we can draw from this, we can see that ACP in palliative care seems to be more common than in other settings in Irish healthcare. I'd refer you back to that 2% of adults in the community who reported discussions with ACP versus the 80% of participants here. They're two different sides of the coin, but definitely a huge gulf there. There is a perception that ACP is really just for older individuals or those with life-limiting conditions. But both pieces of legislation I mentioned earlier say that ACP is for anyone above the age of 18, regardless of their health status. So there's a bit of a contrast there. And then finally, in terms of some of the next steps, interventions generally that target awareness for the general public would be needed, but palliative care staff obviously are aware of ACP and have shown positive perspectives of it. So we're seeing that awareness isn't really translating into action, especially when it comes to kind of the more formal parts of ACP, like signing advanced healthcare directives. So for next steps, like research into kind of the barriers to ACP and especially how to overcome those would be really valuable to ensure that there is kind of an uptick in engagement in ACP, because it's obviously a really important and really beneficial process. So with that, I will finish up, and thank you very much for having me, and thank you all for listening.